The story is the star of life. This is Paul Goodman, Dr. Nacho, sitting with my awesome office manager, patient care corner friend Kate, and we're discussing a patient that we're going to see today. This patient has a congenitally missing, was not born with, a number 7, which we call a front tooth on the upper right. So we're going to share with this patient after ortho what are the options and her parents to replace this tooth she was not born with recognizing how emotional that is for a person, because if you're listening to this, most likely you were born with this tooth. So this patient's gone through ortho and has gone through a lot of extensive treatment, and today we're going to discuss what we can do to get her a tooth. So first, Kate, what I like to do is teach anyone to tell the story, office manager, dental assistant, dentist. So we're going to say what everyone cares about their own problem. So we will remind the patient in a kind way that this tooth, you're very unique, you're very special. You do not have this tooth here on the upper right in the front. It's called a lateral incisor, tooth number 7. You went through all this awesome ortho braces, and now's the time for us to talk about what you can get to replace this tooth. So first, to get a tooth that stays in all the time, how old is this patient, Kate? Don't use their name, so don't use their name. I don't want to violate HIPAA. I don't want to see the hippos at the zoo. I'm very scared of hippos and HIPAA at all times. So a 15-year-old, not easy to be 15, especially not during a pandemic. I remember being 15, not easy. So be positive. To get a tooth that stays in all the time so you can smile just like your friends, we will gently prepare the backside of the teeth on either side. The good news about gently preparing the backside of the teeth on either side is that gently preparing these teeth on either side, gently drilling on these other teeth, do not damage them in a significant way, but part of the informed consent, which I call a heads up, is that we will need to drill on the teeth on either side. This stay in all the time tooth, parentheses, what we call, there's been a Monodont Bridge, which is a trade name, Maryland Bridge has been called, we just call it tooth that stays in all the time, gets glued with strong dental glue to the back teeth of the teeth on either side into the area that was gently drilled on. The good news is you can keep this tooth in all the time. The challenging news, don't say bad news, is that I eat apples, make yourself normal. I eat corn on the cob. I bite into things. And when you bite into things, it is fairly easy to disrupt or break the connection between the glue and the tooth. And then your tooth that stays in all the time will be out of your mouth and you won't have a tooth. What we can do, only a dentist, is we can glue it back into place. How long should something like this last? That is a great question. A lot of people ask that question. The way it works is these teeth that stay in all the time, glued to the back side of the teeth on either side, can last 1 year, 2 years, 3 years. This is a time where your age people play a lot of sports, do a lot of activities, eat a lot of stuff that you might not eat when you're an adult. So it's a high traffic area for chewing. So to manage your expectations, what we do now, you can plan to replace what we do now every 2 years. It would be awesome if it stayed in your mouth longer than every 2 years. So I just wanted to share with you the replacement challenges or expectations. Now, if you were to bite into an apple and your tooth came out, I would be upset if that happened to me. Make yourself seem normal, dentist. I know it's tough for you. What we can do is we can make you a backup safety net tooth that snaps into position, that comes in and out. It's for smiling, not chewing. This removable one tooth that you can keep on you when you go to people's houses, when you maybe wind up even going away to college if you still have this at a time. If this tooth came out, this removable snap-in tooth for smiling will be something awesome to have, so you don't have to walk around without a front tooth. That's what I would want to have. So one, the tooth that stays in all the time, that we gently drill on the teeth in the backside, what we refer to in our dental world as a fixed bridge, Maryland Bridge, Monodont Bridge, which is the trade name. A removable backup snap in and out tooth, and your orthodontist has shared some awesome photos with us. And if now is the time, if it fits into your life at this time, mom, dad, and daughter, giving them a broad picture look, if this fits into your life at this time, our dentist here can use tooth colored material, people call it bonding, to make the front two teeth have the same shape as teeth on either side and not have a space, and not have a space, and not have a space. See, there's a space, it won't have a space. See, you have a space, it won't have a space. So if that's something you would be interested in, we can do that now. If that's something you're not interested in, that's okay too. So Kate, my office manager, who is awesome, we break this down behind the scenes, away from the patient. 1, fixed Monodont Maryland style bridge. 2, interim RPD. 3, facial veneers, composite veneers. This is more than just bonding between the teeth, if you can see the photos. And the patient can choose just one, they can choose 1 and 2, they can choose 1, 2, and 3. So sharing the story is important. So I have my awesome office manager been with me for a decade and knows a lot about dental work because she likes having it done in her own mouth. That's one of her favorite things to do. Kate, any questions about this treatment plan?
No.
So what we'll do now is we will make a list of the treatment with the codes, and then we will make a yellow financial form that shows the cost for just the one part, fixed bridge, Monodont Bridge, Maryland Bridge, 1 plus 2, fixed Monodont Bridge, Maryland Bridge, plus the interim backup, and 1 plus 2 plus 3, fixed Maryland style bridge, plus the interim backup, plus the facial veneers. And we present this to patients like one of my favorite things in life, a menu. Present treatment like a menu. You also share, hey, you don't have to have any treatment if you like. What happens if you do nothing? While it might seem unusual or unique, there's no reason that this patient has to do anything. Give them a heads up on what could happen. The teeth may shift from the orthodontic work. You won't have a tooth when you're smiling. So this is treatment planning. Treatment sharing. Treatment planning is what dentists do. Treatment sharing is what you do with the patient. Treatment planning is what dentists do with each other and their team. Treatment sharing is. So, Kate, do you feel confident sharing this treatment plan with the patient?
Yes.
So we are all set for dentisting fun, because I want to tell you dreams don't come true because I want to play in the NBA, but here I am in my dentisting world. If we can help you in any way, feel free to reach out to us at dentalnachos.com.